Hello, Ting here. Welcome to my presentation Type 2 Diabetes and Obesity Impact on Individual, Care Provider, and Healthcare System. The pancreas is an organ 12 to 15 centimeters in length by 2.5 centimeters in thickness, consisting of the head, body, and tail. It is located retroperitoneally just behind the stomach. The pancreas has two main functions: an exocrine function as part of the gastrointestinal tract system that help in digestion of food, and an endocrine function as part of the endocrine system that helps regulate blood sugar level. Majority 99% of the pancreas consists of exocrine tissue that produces pancreatic enzymes for digestion. The main ones are trypsin and chymotrypsin to digest proteins, amylase for digestion of carbohydrates, and lipase to break down fats. The remaining 1% of pancreas consists of endocrine cells called islets of Langerhans that produce glucagon, insulin, somatostatin, and pancreatic polypeptide. These are water-soluble hormones belonging to peptides and protein class that are released directly into the bloodstream. The two main pancreatic hormones that forms part of the negative feedback homeostatic mechanism are insulin hormone, which acts to lower the blood sugar and is anabolic, and the other counter-regulatory glucagon hormone, which acts to raise blood sugar and is catabolic. Proinsulin is synthesized by the pancreas and is converted to insulin and C-peptide. BMI or body mass index is defined as weight in kilograms divided by height in meters squared. The World Health Organization defines overweight as BMI more than or equal to 25 and obesity as BMI more than or equal to 30. Now, more than 4 million people die globally each year in 2017 from being overweight or obese as part of the global burden of disease. Aging is a predominant risk factor for most diseases and conditions that limit lifespan, including most chronic non-communicable diseases. Aging and pathology can affect the pancreas, causing pancreatitis, which is mainly caused by excessive alcohol. Pancreatic cancer usually occur in people more than 50 years of age. The risk factors for this are genetic, increase in alcohol, smoking, and fatty food. And finally, diabetes, which we will talk in subsequent slide. There are three main types of diabetes. Type 1 diabetes, about 10% of all diabetes, is caused by autoimmune destruction to the islet cells of Langerhans. Patients with type 1 diabetes are dependent on insulin for the rest of their life. Type 2 diabetes, about 85% of all diabetes, this is caused by insulin resistance and or insufficient insulin production. Gestational diabetes, which occurs in 2 to 3% of all pregnancy. There are rare types of diabetes, about 2% of all diabetes, example neonatal diabetes. Prediabetes refer to impaired glucose tolerance and impaired fasting glycemia, which we will discuss in subsequent slide. Signs and symptoms of type 1 diabetes are known as diabetic ketoacidosis, and of type 2 diabetes are known as hyperosmolar non-ketotic diabetes. These symptoms arise from multiple body systems being affected by hyperglycemia. Common symptoms of type 1 and type 2 diabetes include excessive thirst, frequent urination, increased hunger, extreme tiredness, blurred vision, genital thrush, and muscle wasting. The mechanism causing all these symptoms are osmotic diuresis, cellular dehydration, and catabolism. Weight loss generally tends to occur in type 1 diabetes and weight gain in type 2 diabetes. Chronic complications of diabetes include diabetic retinopathy, affecting the eyes, diabetic nephropathy, affecting the kidneys, and diabetic peripheral neuropathy, affecting the nerves. Laboratory diagnosis of diabetes. Fasting plasma glucose more than or equal to 7 or 75 grams oral glucose tolerance test with fasting plasma glucose more than or equal to 7 and or 2-hour plasma glucose more than or equal to 11.1, HbA1c more than or equal to 6.5%, random plasma glucose more than or equal to 11.1 with classical diabetic symptoms. Impaired glucose tolerance refers to fasting glucose less than 7 and 2-hour glucose more than or equal to 7.8 and less than or equal to 11. Impaired fasting glucose equal to fasting glucose 6.1 to 6.9 and 2-hour glucose less than 7.8. Prediabetes refer to impaired glucose tolerance and impaired fasting glucose. 5 to 10% will become type 2 diabetes per year. In gestational diabetes after baby delivery, there is a 1 in 2 chance of developing type 2 diabetes in the next 5 to 10 years. Risk factors for prediabetes and type 2 diabetes include being overweight or obese, close relative, parents or sibling with diabetes, hypertension, hyperlipidemia, more than 40 years of age, polycystic ovarian syndrome in females, and mother giving birth to a baby more than 4 kilograms. Ratio, such as Afro-Caribbean, South Asian, and Native Americans. We note that type 1 diabetes onset is generally less than 40 years of age, whereas type 2 diabetes is generally more than 40 years of age. Some common overlapping risk factors for cardiovascular disease and dementia include the following: non-modifiable risk factors, genetic, family history, gender, and age. The modifiable risk factors include hypertension, smoking, excessive alcohol, which also cause pancreatitis, poor diet, hyperlipidemia, diabetes, obesity, high salt intake, and physical inactivity. There are reversible risk factors and association between obesity or overweight and developing prediabetes, type 2 diabetes, hypertension, hyperlipidemia, or having heart attack and stroke. There is a 5 to 10% risk of prediabetes becoming type 2 diabetes per year. There's an analogy with mild cognitive impairment, where there is a 3 to 5 times risk of developing Alzheimer's disease. Both prediabetes and mild cognitive impairment are potentially reversible with adopting appropriate healthy lifestyle choices. Risk of cardiovascular disease from central obesity or apple shape or pork belly or beer belly is greater than the risk of developing cardiovascular disease from peripheral obesity or pear shape in which fat is deposited on the hips and buttocks. Individuals' quality of life are reduced by obesity and diabetes. This is due to associated osteoarthritis, poor mobility, and cardiovascular diseases. Care provider has to deal with decreased safety. This is due to the higher fall risk. There's an increased risk of developing other conditions such as dementia and cognitive impairment and cardiovascular diseases. In 2017, about 462 million individuals are affected by type 2 diabetes. This is 6.28% of world population. Over 1 million deaths per year can be attributed to diabetes alone, making it the 9th leading cause of mortality. Diabetes affects individual functional capacities and quality of life, leading to significant morbidity and premature mortality. Mentally, about 30% of diabetes and obesity are associated with higher levels of depression, anxiety, and sexual dysfunction. There is a high cost of care for diabetes. This is at least 3.2 times greater than the average per capita healthcare expenditure, rising to 9.4 times when associated with complications. Take-home message: we must aggressively manage diabetes and obesity in the elderly. This can be carried out through healthy diet, regular physical exercise, and maintain good general health with particular appropriate oral diabetic medication and/or insulin, controlling blood pressure, lowering cholesterol levels, and stopping smoking. This will lead to a healthy heart as well as a healthy mind. Here is my reference slide. Thank you for watching.